we're going to apply some of the organic reactions we looked at over the entire year to our lipids here, and maybe bring some light to some of the stuff that we eat or buy. Okay, so first, hydrogenation. We know that, so you'll see on a package hydrogenated oils or hydrogenated, substance, and hydrogenated fats. You'll see. Well, all it is the same thing we've been doing, reducing something or adding hydrogens. We know how to do that. We put it in the presence of a metal with H2 gas, or to add the hydrogens. The hydrogens will add across the double bond, and you'll take an alkene and turn it into an alkane. But in terms of fats, what you're doing is taking an unsaturated fat and turning it into a saturated fat. So what hydrogenation does to our fats is essentially going to increase our melting point, because now we're able to get closer together and have stronger London forces. And what it'll do is it'll take our liquid oils like vegetable oil, and that's what they use to make shortening or margarine, all right, by all we're doing is hydrogenation. So if you were to take vegetable oil and do a reduction using hydrogen and a metal, in theory you should get out a semi-solid fat, which is going to be our margarine or our Crisco, okay, which is shortening. So we could show that here, all right, by taking our triglyceride, and let's say we have a triglyceride that contains all unsaturated, and we could turn them into saturated. All right, we go from a stearate, all right, or I should say a oleate, all right, to a stearate. All right. Another reaction we could do to our fats is hydrolysis. And this is exactly how our fats are going to get broken down. Okay. In our body, our triacylglycerides or triglycerides are going to get broken down via hydrolysis. Now we could do this outside the body with water and a very, very strong acid. It'll drive, essentially break the ester linkage between glycerol and our fatty acid chains, reestablish glycerol, and give us our fatty acids. Inside the body, the digestive enzyme lipase does that. Okay. So, our liver functioning tests, all right, that they test for, one of them is lipase. Okay. One of them is lipase that they test for, and that basically tells you how your liver, enzymes are doing, or how your liver's functioning. So, in our body, lipase is acting like the water and the strong acid that we know will essentially break ester linkages. Okay. All right. Okay. So how do we break down these triglycerides? All right. We store our triglycerides as our adipose tissue. Okay, that surrounds the surface of the skin, breasts and internal organs. It's needed. It's needed for protection. Too much, too little, not good. Here's the thing, though, okay? You don't add more adipose tissue when you gain weight, and you don't lose adipose cells when you lose weight. When you gain and lose weight, the number of adipose cells stays the same. They either swell up or they shrink, but do not increase and decrease in number. And our enzymes, called lipases, again, break everything down. The complete metabolism of a triacylglyceride yields a lot of energy. We're doing an oxidation reaction and almost like a combustion reaction when it gets down to it, if we were looking at it in simple Gen Chem terms. CO2 and water. Okay, we're burning a carbon base up. We're going to get CO2, water, and a lot of energy. A lot of energy to the fact that with glycolysis, depending on how you do the math, you're in the 30s, all right, 36, 38 ATPs at the end. Okay. With a simple triacylglyceride, via something called beta oxidation of the triacylglyceride to turn into your glycerol and have your CO2, water, and your energy, you're talking, fivefold, at least fivefold of what a one glucose molecule will do. We're talking 200-300 ATPs, and that's on a simple triacylglyceride. So the amount of energy that's released from that stored fat, and this is why it's stored and long term, and if you are in a starvation mode or you do diet or whatever it is, okay, your body will start to burn that because it's going to take up or utilize, okay, or try to fix the fact that you're not taking in carbohydrates or whatever it is to get that instant energy. Okay, so definitely needed in our diet, but too much or too little, all right, could cause issues. Well, we already talked about another thing we could do with fats. We talked about this when we were looking at ester linkages and fatty acids and carboxylic acids. Saponification. Our fats, you could use animal fats and really make soap. You take the fats and you react it with a strong base. You use lye, which is sodium hydroxide. What it essentially does is takes our glycerol or triacylglycerides and turns them into our fatty acids, and then the fatty acids react with the sodium hydroxide and turns it into a salt of the fatty acid we talked about. If we use potassium hydroxide, or we use unsaturated fats, specifically polyunsaturated, so multiple double bonded fats, we end up with liquid soaps. So our solid soap you use, again, why it's solid, okay, is because it's all saturated fats. Therefore, the interactions are still great. Our liquid soap has some unsaturation in there. Okay. Or with potassium hydroxide. Soaps usually come from some sort of animal fat, lard, things like that. Okay. You could also make it really well because coconut oil and palm oil are solids at room temperature. All right. So they're all saturated fats. You can make a soap out of that. So your non-animal soaps, okay, animal-based soaps and things like that are made from coconut oil and palm oil. Okay, and all of them work the same way. We talked about they have a polar end and a non-polar end, but it all depends on how long our carbon chain is. And here's what it's showing. Okay, the reaction. Okay, and here's the breakdown of soaps again. if you need to review it. All right, how about our phospholipids? Okay. Phospholipids. All right. We got sphingomyelin as one of our phospholipids, and we got phosphoacylglyceride, or in our case here, glycerol. Same potato here. Okay. Building up our lipid layers, things like that. Okay. So what are our phosphoacylglycerides? All right. They're the main component. They make up our cell membranes. The structure looks just like a triacylglyceride, except one of the fatty acids has been replaced by an alcohol. Okay. So fatty acid chain, and here we end up with a phosphodiester bond to an alcohol. Where this comes from, as you can see here, it's telling you it's the alcohol part of the of an amino group. Okay, that's there. Now, why do we have that? So that we have a polar part and a nonpolar part in our phospholipid bilayer. Okay. And they give you two examples of where you would find it, lecithin and cephalin, and what the functional groups of the alcohol look like. Okay. Notice they're amino alcohols, so they have a nitrogen enriched part to them that is polar. All right, sphingomyelin. Okay. Here's what it looks like. Doesn't contain glycerol backbone. Okay. Has a backbone of sphingosine. Okay. No ester linkages. Single fatty acid bonded. All right. Do we know where sphingomyelin is found? For those of you who took anatomy, maybe you talked about it in bio, but you should have definitely talked about it in anatomy and physiology. It is found in animal membranes, but sphingomyelin is the myelin sheet that's around nerve cells that allows for the quick movement of nerve signals from one spot to the brain and back. So our myelin sheet is made of sphingomyelins, or very rich in sphingomyelins. All right. So what's important about our phosphoacylglycerides? Again, we have a nonpolar part up here with the fatty acids. We got a polar part down here. The ester linkage makes this nonpolar, but down here with our amine end and our phosphates with the negative charge on them, we have a polar part. Okay. What that allows our membrane to do is react with or interact with polar parts and nonpolar parts. These are our biggest parts of our phospholipid bilayer. Okay. Allows for that, fluid mosaic model again. A review of biology, we got protein channels in here and the phospholipid bilayer, but what the lipids allow us to do is our polar end, all right, is exposed to the surface of the cell, which is going to be exposed to most of the water, and the inside of the cell, which is also going to be polar, and what's holding it together, the bilayer, is the nonpolar hydrophobic ends are exposed to one another to hold the layer together. Semi-permeable will allow some stuff through and other stuff not through on its own. And then again, we have channel proteins and transmembrane proteins. So this is a transmembrane protein because it goes across both of it. That allow larger molecules, but they have to be opened and closed via cell signaling. Okay. I'm not going to spend a lot of time going over the biology stuff again with integral proteins and things like that, for the fact that you've seen this multiple times already. All right. But there are carbohydrates attached to the exterior of the cell. We have glycoproteins and glycolipids inside the cell membrane. Simple diffusion again. I'm not going to get into the biology part of this. If you needed it, I left it in because I kind of used this one in combination with another one when I used to teach biochem. Let's get into the more fun stuff in steroids. Okay. All steroids. All right. Again, at the beginning of this lecture, not today, but on Monday, we said that lipids are classified, but they don't have a specific functional group. Okay? So they're all grouped together, but there is no specific functional group where I can look at and say, well, that's a lipid. All right? So here is another one that has a different setup, but it's still considered a lipid. So a steroid has 4 carbon rings. Number 1 needs to have 4 carbon rings. Okay? Attached to these 4 carbon rings are different types of compounds. There could be OHs, there could be NH2, whatever it is. Okay? And that will give the specific steroid a specific function, or give it the specific type of steroid we're talking about. Fatty acids are not in steroids. Okay? So cholesterol is a steroid. Here is the structure of cholesterol. Okay. I'll tell you right now, those of you who have to take biochem, I would bet money on it. Okay? That you will need to know the structure of cholesterol, and you'll need to know the numbering of cholesterol's carbons. Okay. Cholesterol is the most abundant steroid that's in the body. It's insoluble in water. Which means that in order to move it around the body through a water base, it needs a carrier. It needs something to help it that is water soluble. Okay, and as you can see, there's CH3 groups, alkyl groups, and an OH down here that is bonded to the 4-member ring steroid nucleus. Also, double bond there. Okay. Where do we get our cholesterol from? Meat, milk, eggs. Synthesized in the liver from our fats, carbohydrates, and proteins. So again, talked about it in the past. Hey, I cut out all my fats. What's going on here? Why are my lipids high? Why is my cholesterol high? Well, the reason being is your carbohydrates will then be turned into those. You can't completely cut out cholesterol. You need it in the body. It's needed for cell membranes. It's needed for nerve tissue. It's needed for hormones. It's needed for vitamin D production. Problem is, large amounts of it, all right, end up with high levels of plaque in the blood. Okay. You can't get your cholesterol from vegetables or plants. Now, you can synthesize it from other carbohydrates and things in your body. Okay. But you're not going to get any direct cholesterol from your plants and vegetables. It's an animal thing. Okay. Lipoproteins. These are fun. All right. Water soluble So therefore, they're soluble in the blood, form of lipids. Okay. Lipoproteins is the way we could transport our cholesterol and our triacylglycerides and all of that fun stuff throughout the body. It has a polar surface, which makes it soluble. And in the interior is a non-polar, where all my triacylglycerides and things sit in there. Okay. They'll travel through the bloodstream to the area where they're going to be stored, and then later used to give us energy or to make hormones. All right. So let's talk about all of these here. VLDL, LDL, HDL. All right. VLDL is very low density lipoproteins is what it stands for. We're talking our triglycerides and our cholesterol. The one they usually measure you for in a lab setting is LDLs and HDLs. LDL is your low density lipoproteins. That is your bad. HDL is your good cholesterol. Okay. You want your total cholesterol serum, if possible, to be under 200 milligrams per deciliter on average. Again, these are in general. Each person's going to be different what they're going to shoot for. You want your HDL to be above 40 milligrams per deciliter. You want your LDL to be under 100. So looking at your total cholesterol isn't enough. Hey, I've got a total cholesterol 190, but my LDL is 120 or 160, and my HDL is 30. Well, I'm still under the 200, but I have a lot more of the low-density lipoproteins than I do the high-density. So what they're really measuring is, looking at your low-density and high-density lipoproteins, they're looking for those water-blood soluble transport molecules in your blood setting. How many of them do you have? The more LDL you have, the worse it's going to be. So what happens here? Why is HDL good? Okay, and LDL not good? Well, it's all about how it's broken down. Okay. Now, we keep all of these in something called, chylomicrons, and that's that little round lipoprotein that we saw in the last thing that allows us to transport them throughout the body. But here's why your HDL and your LDL is good, bad, however you want to look at it. Your HDL basically comes from your heart and your muscles, and it gets broken down in the liver and boom, out and not stored in the body. Your LDL is the one that's produced by your liver and ends up being stored in your heart and muscle area, which means then we're talking about clogging arteries and things like that. Eventually you can get it out as energy, but large amounts until I need that energy are just going to sit here waiting, as opposed to, oh, I have this and we're going to get it out. Okay. So we have it stored here as fats. Then they come over here and they can store, and then out as energy. VLDL. Okay, so our HDL will be utilized. However, we need the cholesterol in our body, and boom, out. And not sitting in us for a long period of time. Okay. How about hormones? Hormones are also considered fats. Okay, they're synthesized in an organism, and depending on where they're released and what type of hormone, they'll elicit a specific response by the body. Okay, so we have our sex hormones, estrogen and progesterone in females. We got androgens in male, and then we have our adrenal cortical steroids. Okay, so they're the two types of steroid hormones that we essentially find in our bodies. Okay. There's two types of estrogen. There's the alcohol version, okay, and there's the ketone version. They both have the same structure except on, look, they both have the steroid 4-member ring, except this one, all right, has alternating double bonds this time. They both have an OH down here. But the big difference is one of them has an OH group, the diol, do, diol. All right, and over here, this one has a ketone. Okay. So, what does estrogen do? Secondary sex characteristics, menstrual cycles, all right, and ends up being made in the ovaries. Okay. Progesterone, which is known as the pregnancy hormone. So if they're doing a test on someone to see if they're pregnant or not, that's what they're going to be testing for. Progesterone is needed. Okay? Very important. All right. And why it's very important in the pregnancy hormone, it's right here. The egg gets fertilized, and now it needs to be implanted in the uterus. If your progesterone levels are too low, even though the egg gets fertilized, okay, the person cannot get pregnant because it will not implant in the uterus. You may get a positive pregnancy test, but a few days later, you test again and you aren't pregnant anymore. Or a week later, or 2 weeks later. So you get all these positive tests and then it doesn't, well, what happens? Were you pregnant? Was it a false positive? Could have been a false positive, but it could have also been something like this, where yes, the egg was fertilized, but it just could not implant in the uterus. So what do they do for that? They'll prescribe you, or you'll prescribe the patient progesterone tablets to take to increase the amount of progesterone to make sure that that fertilized egg gets implanted. Okay. In males, we have testosterone and androsterone. All right. Now look, it's almost the same thing as in females with the estrogen. We have a ketone down here and an OH up here, an OH down here, a ketone up here. And the difference is, besides that flip-flop, a double bond. What these two do is control basically the secondary sex characteristics in males. Okay. And then what about the other ones, okay? Androgen analogs are called anabolic steroids, okay? Our anabolic steroids are the ones that produce or promote muscle growth. So androgen, which is normally found and created by the body, if we make analogs of those are the anabolic steroids that we talk about, that athletes use to get an advantage or whatever it is. They have the same effect as testosterone, but they're more stable, so they get metabolized a lot more quickly through the metabolic rate. Or they have a faster metabolic rate is what I'm trying to say here. Okay. The problem with using anabolic steroids, although it sounds great, they break down fast, we could do all that. Okay. They've been shown to, well, number one, cause physical problems. Okay. And they could also cause, so roid rage is a real thing. Although we call it on a nickname of roid rage, the injecting yourself with anabolic steroids could alter your mind. It disrupts your brain chemistry because it's not a natural found thing, or even though it's recognized as an analog of a natural hormone, your levels get so high it changes the brain chemistry. Physical characteristics, we all know you break out in acne. All right, you could have impotence problems, things like that, using them. Okay. So here's our anabolic steroids. If you take a look back at, let me go back 2 slides here. Okay. If you take a look at this right here, androsterone, and come back here, you can see how they are analogs of these. If you remember, and again, I know you guys are young and probably don't remember it all. But those of you who are a little older, I don't think any of you are around my age. But anyway, Barry Bonds, at the time, Balco was this industry that was tied to steroids in athletes and things like that. And they had a thing called the cream and the clear that you just rubbed on your skin, and all of a sudden you became this muscle-bound freak. All right, and people were, breaking the home run records, and Barry Bonds was one of the ones that you could definitely tell from when he was younger to when he started playing later in his career. His head got bigger, okay? He bulked up, and it was all based on, well, not proven, but assumed based on this, and the clear of the cream, that's what it says, or the clear. This was what was in the clear, all right, that they were using, all right, as athletes. So it went from being injected. I mean, this started in the 80s with the Oakland A's, and they were called the Smash Brothers, and there's documents of them, being told that they're going in the bathroom and like injecting each other with these hormones and stuff. Okay. So steroids, again, the other ones we said that are natural, besides the sex steroids, are the adrenal cortical steroids. Aldosterone, okay, which regulates blood pressure. All right, which, again, how does it do that? It regulates the amount of sodium and potassium in our fluids. Cortisone, anti-inflammatory agent. Okay, it also regulates carbohydrate metabolism. All right. Hydrocortisone is the cream when you have a rash or something. Again, it's an anti-inflammatory agent. Okay. So cortisone is used to suppress organ rejection after transplant surgery. It could be used to treat allergies and autoimmune disorders. But steroids have a undesired side effect. Number one, okay, bone loss over prolonged use, high blood pressure, okay, overuse also. One of the big things, me being a diabetic, okay, I can't use steroids if I have a lung infection. I have to talk with, or a lung problem, let's say not an infection, but let's say I have, let's say I have a sinus infection, and they want to open up my lungs, and they want to use steroids. You guys would go to the doctor, they give you a steroid pack, and go with it. I can't. Okay, I can't because of my diabetes, because injecting with steroids causes a spike in blood sugar. Okay. So, prednisone, okay, which is a synthetic alternative, anti-inflammatory, so they would probably give you some prednisone. Thing is, I can't take prednisone. Okay, I'm not saying me, but diabetics. So sometimes you have to sit there and you have to say, well, how well controlled is the patient's diabetic, glucose levels? If I give them a small dose of prednisone, there is going to be a spike in the glucose levels, but will it be able to be tolerated by the medication? So I've been told multiple times, okay, to when I've had upper respiratory infections, to keep an eye on it. We're not going to give you any prednisone, okay? Use, nasal spray, but not the one with steroids in it. You just use saline solution and so on and so forth. So although steroids have, a great effect, and they're anti-inflammatories, and they can open it up and give you, you have to watch using them. I know of people who know that the steroids are going to help them with, lower back pain and things like that, and basically, go play to urgent cares and things like that, and say, well, no, I'm not diabetic because, the pain that I have is, in their mind, the pain that I have is a greater problem than essentially worrying about my blood sugar going a little high. And again, without being in that pain, I'm not one to judge what you got to do to survive. But I'm just saying that those of you who want to be pharmacists, if you see someone on diabetic medication and then see them on prednisone or some sort of steroid. Make sure that they're aware of that. Okay, make sure their doctor's aware of that. Make sure they've discussed that. Red flag that is what I'm saying. If you're going into the medical field, understand that interaction. Again, you're going to learn all this again over and over and over again. I'm just laying down the path for you. How about vitamins? Okay, vitamins are organic compounds, all right, that are required very small quantities in normal metabolism. We can get them from our diet. All right, our cells can't synthesize vitamins. Vitamins are either water soluble or fat soluble. Okay, there's 4 fat soluble vitamins, A, D, E, and K. They're the lipids. They're nonpolar. Okay, where do we get them from? A, D, E, and K, fruits, vegetables, fish, liver, dairy products. Any excess vitamins we make, or intake, I should say, instead of make, we intake, are stored in our adipose tissue to be used for later when needed. So, vitamin A, found in liver, fish, and dairy products, made from beta-carotene. Beta-carotene, so you're looking for things that are rich in orange pigments. Now, again, fish and dairy and liver are not, but your bell peppers. All right, so you're looking for, if you're low in vitamin A, you're looking for things that are rich in beta-carotene. What is it used for? Vision. Vitamin A is vision. That's why they would say carrots are good for your eyes. Okay. Also needed for mucosal membranes, but vision is where it goes. Deficiency in vitamin A could cause night blindness and dryness, since we're going to not have healthy mucous membranes, dry eyes, and dry skin. Vitamin D can be synthesized from cholesterol. All right, obtained from our diet, specifically milk, dairy. All right, helps regulate calcium and phosphorus metabolism. Deficiency in vitamin D can cause rickets, which is a bone malformation. Vitamin D can also be synthesized by UV light from the sun. So if you're one that doesn't go out, all right, again, it has to be obtained from your foods and come specifically from cholesterol, but the sun could help in increasing your vitamin D levels. All right. If you don't go out often, your vitamin D levels are low, you take a supplement. Vitamin E is an antioxidant. Vitamin E you're going to find in your olive oils, your nuts, avocados. I should just look at the picture here instead of thinking. I'm literally looking up at the sky thinking where you find vitamin E instead of just looking. Dark chocolate. All right. Tomatoes, apples, broccoli, things like that. You need vitamin E. It's an antioxidant. All right. It protects unsaturated side chains and fatty acids from oxidizing. We need vitamin E. You are deficient in vitamin E, it'll cause huge problems in your neurons and brain activity. But the good news is it's rare to be deficient in vitamin E. Vitamin K, your dark vegetables, your dark green leafy vegetables, kale, spinach, things like that, corn, olives, nuts. All right, regulates the synthesis of clotting protein. And if you're deficient in vitamin K, all right, it could lead into essentially you bleeding out kind of thing. Okay. Eicosanoids, all right. We're getting to the end here, guys. All right. Eicosanoids are synthesized in response to an external stimulus. All right. What they do is, like they say down here, local mediators. They do their function in the environment. They don't move where they were synthesized. Very potent stuff. So prostaglandins are carboxylic acids, 5-member rings. Okay. And they do a lot of things depending on the area in which they were produced. They're very potent, if they're coming to do their job, they're going to do their job plus. All right. They are there for a response for inflammation. We want to lower their amounts in response to inflammation. We take aspirin or ibuprofen, and it blocks the synthesis of the molecules. And you can see everything else these prostaglandins do. Gastric secretion and so on. Okay. We're not going to worry about the different enzymes. Yeah. All right. So leukotrienes, asthma is characterized by chronic inflammation. So leukotrienes are the molecules that contribute to the asthmatic response. What they do is, okay, I have this irritant in, and it's going to cause my smooth muscle into my lungs to essentially contract, blocking the airway up. So what does your inhaler and things like that do? Blocks the formation of those, opens it back up, and allows you to breathe again. The thing is, you are injecting yourself with a steroid. So here comes the game with steroids again. You got to weigh the risk versus the reward. Not breathing versus raising possibly your blood sugar or something like that. Of course, you're going to take the inhaler if needed. Okay. All right. So that is our last slide. Forever.